What can you expect when it comes to labor? Like, how do you know that you're in active labor? When should you go to your birth location? Like, there's a lot of questions when it comes to how do I even know that I'm in labor? So in this video, we're going to talk about what are the stages of labor? What are the common clues to let you know where you are within the labor timeline so that you know when you should be at your birth location? And then what can you do during each of these phases to help support your labor progress? Hey, I'm Gina. I'm a perinatal fitness trainer and birth doula and currently pregnant with baby number 4. So I do have a lot of personal experience with navigating through the stages of labor, and I'm excited to share with you how I felt and then also how a lot of my clients have felt.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife. I have had 3 babies and I've supported many, many births, usually in that early active phase, so the later portion of labor, not necessarily the beginning, but I've been able to support a lot and experience it, so I have both professional and personal experience as well.
So with labor, there are 3 main stages. The first stage is going to be the dilation. So this is what we typically think of when we think of labor. So the cervix is going from that 0 centimeters to this 10 centimeters, and it's just until you start pushing. Once you start pushing, you move into the second stage of labor, which is expulsion. So we're pushing the baby out of our body. It sounds aggressive. Sometimes it feels aggressive too. Once your baby is born, you then move into the third stage of labor, which is we have to birth our placenta as well, in case you forgot. But it doesn't have any bones, so it's a little bit easier. It comes out a little bit easier, much easier than the baby does. Within the first stage of labor, there are little phases within it as well. So we have the latent phase, which is typically like early labor, and then we have the active phase. So this is like active labor. But within those, there are also like tiny portions as well. So the very first part of labor is early labor. And so this is typically when your contractions are more than 10 minutes apart. So I would say like 10 to 20 minutes apart, but they're coming at a frequency. So every 10 minutes, you have a contraction. Every 10 minutes, you have a contraction. Typically, these contractions are pretty easy to work through. You are not affected at all by these. You can sleep through them. You can talk through them. You can do all sorts of things to them. So if you are sleeping, you may sleep through it and not know that you are in early labor, and you may wake up in a little bit more of an active labor pattern. So for those of you that are like, I've never experienced early labor, I just woke up in active labor, you may have been sleeping during it, or you went really fast during it, which is also a possibility as well. Typically, early labor is the longest phase of labor. Typically, not always. Most of the time it is. And so during this phase, it's really helpful to focus on resting. So if you're tired, go to sleep. If you woke up from a full night of sleep and you are well rested, you can get up and start moving around, like doing some gentle movement, go for a short walk. And then eating food is really important during this phase, because usually at this point, you can still tolerate like eating a good meal. So focus on eating a meal that's high in fat and protein to help sustain you during what may be a longer labor. I would say most folks are going to be in labor for at least 12 hours at like the early side, probably closer to like the 18 to 24 hour mark. But this does include early labor. And now again, there are some folks that are a little bit more expedited in that timeline. But in general, you can probably expect for there to be several hours before you meet your baby. So eating food, focusing on rest and nourishment during this phase can be super important.
The next phase is the transition phase between early latent labor into active labor, and we call this early active labor. So this is where you notice the contractions, you need more support during those contractions, but still in between, you're completely fine. You can still hold a conversation, talk to everyone around you, do what else. Like some people will like be cooking a meal, stop during the contraction, and then like restart the meal. During this phase, I almost refer to the contractions as like the commercial break. It is like you're watching a TV show, the commercial happens. I guess if you still watch live TV, the commercial happens and then it just picks right back up to where it was left off before the commercial. That is what early active labor is. The contractions may be like 5 to 10 minutes apart. Again, you need support during it. In between, you're completely fine. So this is still where we want to try to emphasize the resting and the eating. But depending on your pain preference for labor, as well as how far away from the hospital you live, early active labor may be the time that you start thinking about heading to your birth location. So if you're at a birth center or hospital and you have to drive there, thinking about that. Or if you're like at Target and you're delivering at home, maybe head home now.
After early active labor, we transition into active labor. And the key difference between early active labor and active labor, because it is confusing at first, is the in between. So during contractions, you're still needing a lot of support. You may be needing more support. You may be vocalizing more during your contractions, making a little bit more noise. But in between contractions, when you're in active labor, you are in your own world. You are no longer mentally present in the space that you're in. And so a key thing that I notice for like my doula clients when they are making that transition from early active to active labor, and this was something that I felt for myself as well when I like knew that I was transitioning, was they no longer want to be on their phones. So they'll be like texting me and like telling me how everything is going and like giving me updates. And then all of a sudden their husband or their partner is calling me or texting me to let me know how things are doing. Because for whatever reason, like being on your phone when you're in active labor is just strenuous. It's like mentally exhausting. And it's just like, I can't do it. And so that's like a big clue for me that my client has transitioned into active labor is they cannot even focus on using their phone anymore to like communicate with me because they are in their own little world. For me, when I was in active labor, I almost felt like it was like fuzzy around where I like couldn't quite focus on things around me. Like I could if I really needed to, but I was just like kind of like you're like almost have like tunnel vision where you like just don't really notice things around you anymore. You're just like focusing like completely internally. You're in like what we refer to as labor land. At this point, contractions are also much closer together. So they're like 2 to 3 minutes apart. So you have like a minute long contraction, and then you have 1 to 2 minutes of rest, and then you have another contraction, 1 and 2 minutes of rest. And so when you're in active labor, if you are wanting to have an unmedicated birth where you don't have any pain medication, and this is dependent on you and how you define that. Some define unmedicated as no epidural. Some define it as like no pain medication at all. If you're wanting to have an unmedicated birth, you may want to be closer towards the end of active labor before you make it to your birth location, but you don't want to show up when you're pushing either because that can be really stressful. If you're wanting an epidural and you're like 1,000%, that is what I want, you might want to show up at your birth location kind of towards the beginning of this phase. So when you feel yourself starting to shift, that would probably be a really good time to be like walking into your hospital to get your epidural because there is a time delay from when you ask for it to when you receive it. And that can be like a several hour time frame. So you don't want to show up when you're 2 centimeters, but you don't want to show up when you're pushing your baby out either if you're wanting an epidural.
Yes.
So active labor is a really good time to be arriving at your birth location. Where within active labor will kind of depend on what your pain preferences are.
And then the last phase of the first stage of labor is transition. So this is where you are starting to transition from the dilation stage into the second stage, which is pushing. Transition is a time where we're releasing a ton of stress hormones within our body. And this is a benefit because we're helping our baby. Those stress hormones are going to our baby to help ramp them up to live outside of the womb. Because right now you do all of it for them when they're in the womb. You're, breathing for them. Like it's just happening. They don't have to do anything. But once they come out, they have to learn to breathe on their own. They have to learn to eat on their own, regulate their own temperature, and like do a lot of things to live. So those stress hormones are a good thing for them, but not always great for us. Like depending on how you respond to like stress in your daily life, if you are a very chaotic, stressful person, that may be how you experience transition. If you're very calm, cool, collected, people just show up to the hospital like, I'm about to push out my baby. That is that spectrum. Most of us are not going to be either calm as a cucumber, just saying, I'm pushing now, to like literally screaming, like, I don't know what's happening. This baby's coming. It's just screaming. Most of us are going to be in the middle during transition. This is where we're just confused, like unsure of ourselves, like the confidence that we were experiencing in active labor is starting to go away. We also will start to feel some physical symptoms of those stress hormones. So you might start noticing like you're shaking uncontrollably, you're feeling very nauseous all of a sudden, or you might honestly start to feel like you need to poop. That could be the stress hormones as well as like your baby descending in your pelvis. So transition can be very overwhelming. And that's completely normal and common. But in the moment, know that it is the shortest phase. Almost for most of us, it will be the shortest phase of labor because it's just that transition and all of a sudden you'll just start pushing.
A common thing that I'll see for my doula clients is when they're in transition, when I ask them a question, they'll say, I don't know. When they previously were very confident about the things that they were wanting. So what labor position would you like to try? I don't know. What comfort measure would you like to try? I don't know. Everything suddenly, I don't know. Or if their plan was to have an unmedicated birth, they will suddenly start feeling very doubtful about that and want to get an epidural. And so for myself in transition, when I am at home, because I have had home births, I will be like in my head, like, how far is the hospital? How long would it take to get an epidural? And that's usually when I know I'm in transition. And I'll be like, I'm not going to make it, so I might as well just have this baby here.
Yeah.
But for me, there's like a moment of doubt and that emotional release where I'm suddenly very like weepy and like just very like overwhelmed emotionally. And I need like tons of like emotional and physical support during that time. And that's how I know like I'm going to push my baby out soon.
It's a common time. You just ask for help. So I'm either confused or you start asking, like, I just need some help. Like, this is never going to end. Those are very common things that people say.
And so that stimulation of your sympathetic nervous system is going to help to get you ready to push your baby out. It's a physically intensive activity that may last for like a few seconds or it may last for a few hours. And so it could be a period. There's a range when it comes to how long you push. If you have an epidural, typically you push a little bit longer, especially if it's your first baby, because you've got to figure it out. Like, you got to reconnect that mind-body connection. Most of us don't push babies out very often. And so it could just take an hour to figure out like the mechanics of it. And then maybe like another hour or two to actually then push the baby out. If you're unmedicated, because you can feel a little bit more, you may be on the quicker side with pushing. So typically for my clients that don't have an epidural when they push, they're usually within like 30 to like 90 minutes, like babies are born. When they have an epidural, I would say like it's the 90 to 3 hour like time frame that we typically see, because it usually takes like the first hour is just figuring it out.
Yeah.
If this is your subsequent baby, so this is not your first vaginal birth, usually it's faster. Usually. Don't come for us if it's longer the next time. Sometimes babies are a little bit bigger the next time. For me personally, my first baby was like 2.5 hours of pushing, and then the next two were maybe like 5 to 10 minutes of pushing, which still feels like a long time, but in comparison, relatively short. They came out, and the path has been paved. The path has been paved. I understood the mechanics a little bit better subsequent times. When it comes to pushing, there's really two options. You can either be coached, where someone kind of guides you through each push, or you could just do you. Like, you just do your own thing. So if you have a really strong pushing reflex, which I would describe as vomiting out of my vagina, like you cannot control it. Your body is just uncontrollably pushing, similar to vomiting. You can't stop it. You're just along for the ride at this point. If you have a really strong reflex to push, you're just going to do you. You're going to push when you need to push, and you're going to rest when you need to rest. With coach pushing, this is more common if you, one, feel really overwhelmed by pushing and you need someone to guide you through it, or two, you have an epidural and you can't really feel anything, or you don't feel when your contractions are happening. Having someone guide you can be really helpful. And so coach pushing tends to be really common in like a hospital setting, or if you have an epidural. Either pushing strategy is totally fine. There's no like best pushing strategy for everyone. It's all about what you choose to do. And we have a ton of videos on our YouTube channel that break down pushing strategies such as positions, how to breathe. And then we also break it down way more in our online childbirth education course. We have an entire section dedicated to just pushing, because it can be a really like anxiety producing time that a lot of us are thinking about, like, oh my God, like what do I even do when it comes to pushing? But after your baby has come out and you are holding them on your chest, your placenta also has to be born.
Yes. So a lot of people forget that they have to birth the placenta, and some people don't even notice that it comes out, honestly. On average, placentas take between like 2 to 5 minutes to be born. It's fairly quick. And again, they might ask you to push. If it's just like kind of like sitting there, you just need to push a little bit for it to like plop out, or like it again just like wiggles out and you don't even notice. For some of us, though, we can have what's called retained placenta, where the placenta does not come out on its own within 30 minutes. If you are in a hospital setting or even a birth center setting, they may need to like go in there and kind of like scoop it out, which is called a manual removal of a placenta. Not the most comfortable procedure, if you can imagine. But this is because if the placenta stays within the uterus for a long period of time, this can increase the amount that you're bleeding. Because when the placenta is in the uterus, it cannot contract down to stop the blood flow that is happening from the wound where the placenta was attached to in the uterus. So within the uterus, that placenta is like embedded into the uterine wall. When the placenta detaches, those blood vessels that were feeding the placenta to give the baby oxygen and nutrients need to close off when the uterus contracts. If the uterus does not contract down, all of those blood vessels are just bleeding into your uterus until that placenta comes out, or if there's anything within the placenta until that comes out. There are two different types of management styles, so how they kind of take care of this stage of labor. There is a more active management where they're trying to encourage the placenta to detach and come out quicker with medications and what's called cord traction, where they're just gently pulling on the placenta to kind of get it to detach using the umbilical cord. And then the medication that they're going to utilize is Pitocin, because that causes uterine contractions to get the placenta to detach from the wall. And this is in hopes to decrease your risk of postpartum hemorrhage because they're getting the placenta out quicker. Where they can also do what's called expectant management. And this is just waiting for your placenta to detach on its own and then deliver itself. So they're not giving you any medications. They're just looking for signs of the placenta detaching, which is you'll see if you can see your uterus in your belly, it'll actually lift up once the placenta detaches, which is one of my favorite things to see, I think. It could also give a gush of blood. And this is from, again, that placenta detached. Those blood vessels have a gush of blood before it contracts down and stops, as well as the umbilical cord obviously is going to get longer because the placenta is coming. When they see those things, that is a sign that, the placenta is detached, it's ready to be born, and then they deliver the placenta. This can last up to 30 minutes before they see those signs of placental detachment. And if it doesn't happen within 30 minutes, if you're in a hospital or potentially even a birth center, they might go in and scoop it out. Every home birth provider kind of has a different protocol on whether or not they'll go in at 30 minutes or they might have a longer wait time, depending on your bleeding levels. But with the placenta, after it comes out, you have the option of keeping your placenta, doing stuff with your placenta, or the hospital or birth center can dispose of it, which I think the placenta is the coolest organ. You should look at it.
So hopefully this video helped to explain what to expect when you go into labor. So there's different phases to labor that have different goals. So the first stage of labor is the dilation, the labor portion that most of us are thinking of, and it's divided into two sections. We have the early phase and the active phase. The early phase, typically you're feeling pretty good during your labor. You might start to need a little bit more support with contractions towards the end of that early phase as you transition into active labor. When you're in active labor, you need support during contractions and you're kind of in your own little world. And this would be a good time to start making it to your birth location, depending on what your pain preferences are. Then these are important to not only kind of pump baby up to transition from being inside to now being outside and having to do a whole bunch of stuff all by themselves, but also kind of amp you up as well to start pushing, which then brings us to the second stage of labor, which is pushing your baby out. This phase can last 1 to 2 pushes to several hours. It kind of varies depending on whether or not you have an epidural, what number of baby this is for you, how motivated you are feeling while you are pushing, and just what it feels like for you to get the mechanics going. And then we move into the final stage, stage 3, which is the placenta. It also has to be born. And then once that placenta has been born, you are officially postpartum, and then you've got a whole bunch of other stuff to learn all about. So if you want more support during your pregnancy, you're trying to figure out what can you expect when it comes to birth, check out our online childbirth education course. Our online childbirth education course is going to teach you the science of birth. So understand what is actually happening, why is it happening, and then what tools can you use to help support your labor progress, such as labor positions, comfort measures, things for your partners to do, in addition to, again, diving into those pushing things and a little bit into postpartum. So if you want to check out our online childbirth education course, check it out on our website at MamasteFit.com, and you can use code YouTube10 to get 10% off.
And if you want to learn what to expect during that postpartum period from once the placenta is born afterwards, check out our postpartum education course where we discuss what to expect in that first month postpartum, as well as signs to look for to seek more help and what is actually normal. We include what to expect for both you and baby, and you can check that out and bundle it with infant CPR and infant massage.
So thanks so much for watching this video. If you enjoy this video, be sure to like and subscribe to our channel. Your subscriptions help our channel grow and then also help us to provide all of this free content to you. So thanks so much for watching. We're really excited to support your pregnancy, birth, and beyond.